I'm Pete Fischbach. I'm the Fellowship Program Director here at Emory and Children's Healthcare of Atlanta for the Cardiology Program, where I also serve as the Director of the Arrhythmia Services.
I'm Susie Hupp, and I am the Associate Program Director for Cardiology. I am also the Program Director for our fourth-year fellowship in Cardiac Intensive Care.
I'd like to welcome you to your visit and hope you get the most out of your day today. I am really excited about our training program, and I hope you get a sense through the day to find what your training here in Atlanta could be like. We have a very busy clinical enterprise here as well as a large research footprint. Children's Healthcare of Atlanta is made up of 3 hospitals here in the city of Atlanta. The primary place where most of the cardiovascular care is performed is here at Eggleston Hospital, and that's where you'll spend the majority of your time as a clinical fellow. Our outpatient clinics are spread throughout the state, and we have many in the metro Atlanta area, and the fellows will spend 1 day a week in their continuity clinic over the 3-year time period. We have a 5-day-a-week clinic at the Center for Advanced Pediatrics, which is about 2 or 3 miles from our main campus, as well as several other clinics spread throughout metro Atlanta that are easily accessible by car.
The Cardiac Intensive Care Unit is one of the best in the world. We offer over 1,000 admissions a year, which is one of the top centers in the nation. We have a 27-bed cardiac ICU, and we have full-time surgical staff with 5 full-time surgeons.
We do probably close to 800 surgeries a year, over 1,000 heart catheterizations, more than 200 catheter ablations. We have the busiest echo lab in the country, so there's plenty of clinical volume to be had. Relative to our clinical size, we actually have a very small fellow roster, and that means that you are hands-on with everything. You'll be pushing catheters, you'll have your hands on echo probes. We tend to have few advanced 4th-year fellows, which means there really aren't many people standing in your way.
The fellowship training program has several academic conferences that occur throughout the week. We have a patient management conference where the fellows are lucky enough to hear all of the portions of our cardiac care come together, from surgeons to imaging, electrophysiology, transplant, and all of the outpatient doctors come together to talk about patient care for individual patients. We also have imaging conferences throughout the week, conferences about intensive care, conferences about electrophysiology, as well as our core conference, which is weekly, where they get to hear lectures not only from each other, but also from all of the faculty in the Division of Cardiology.
Fellowship is a time that you are making a transition between being a trainee and being a true provider, and you are moving from mentee to mentor. And part of our role here in Atlanta is to help usher you through that transition. And that touches on a little bit the hidden curriculum that we have here in Atlanta. And that hidden curriculum is all about becoming a really, really good clinical cardiologist, as well as recognizing that as a cardiologist, you are a consultant and we run a consultative service. And that means we need to serve the people who are calling on us to see their patients. We are in a service industry, and one of the things that I think we do very well is we teach people how to interact with the people that they are serving, whether they be patients, referring doctors, or your colleagues within cardiology or within the other subdisciplines in pediatrics. So I think that our clinical strengths jump off the page, but I'm not sure everyone fully understands the depth of our research interests here in Atlanta. We have a wonderful partnership with Georgia Tech and with Emory University, which includes Rollins School of Public Health, as well as Gosweta Business School and all of the other parts of the university. Additionally, we have very close ties with the CDC, which happens to be right down the street, which gives us access that's impossible to recreate anywhere else in the country. We have several of our clinicians who are devoted to outcomes research. We have an entire arm just based in the basic sciences. As a fellow, you have access to all of those things, and we have a very strong research branch that can help with preparing IRBs, gathering data, and full statistical support for your presentations.
Several of the faculty in cardiology in the Cardiac Intensive Care Unit, as well as our cardiothoracic surgeons, work with researchers at Georgia Tech in the Biomedical Engineering Department. Some of those projects include anything from working on valve tissue, working on heart tissue, including things as sending tissues to space along with NASA. And so this provides anyone interested in that arm a very close relationship and a very strong working collegiality with the other centers here in Atlanta.
We've had really fascinating work being done looking at strain rate imaging in our echocardiography lab, both from our EP interested fellows as well as our imaging fellows. We've had fellows working closely with the faculty at Georgia Tech looking at ways we can use cardiac MRI and surgical preparation. We have fellows who have gone into the basic science labs and have helped work with artificial valves as well as with devising ways to treat pulmonary atresia VSD, for example, by creating new blood vessels which could be implanted. We have a very active scholarly oversight committee that ensures that everyone gets through this program without having to worry at the end of their fellowship, oh my gosh, I'm stressed to put together a project. We've never had to push a fellow into their third year without having their first authored publication or having fulfilled their research requirements. It is more likely that you will be at the end of your first or second year having already completed it and looking for more projects to do.
I think the fellows here are really part of the group. There's not a difference between faculty and fellows when we're all sitting in a room. We really value each other's opinion and what everyone has to offer for the care of the patient. Our goal here really is not at the end of the day to train good fellows, but to train good attendings. Because when they walk out the door here, we want everyone to enter the attending world as successfully as they can be.
I love coming to work because it's fun. I have fun when I come to work, and I have fun all throughout the day. And it really is coming to work with your friends. And I think this is a unique place where the fun doesn't stop at work. We have people who will go out and socialize together, not because they're work colleagues, but because they're actually friends. Many of our faculty members go out together socially, not just at night, but will actually go on vacation together, not only with each other, but with their families. And the families become friendly and the families grow up together. And it really is a great resource, and it makes for a much more productive work environment when you're coming to work with your friends every day. You know, one of the things that's really important is to remember that teamwork is a choice. You choose to be on a team. And we are looking for people who want to be on a team. And part of being on a team is supporting everybody and doing things together. So we certainly try and practice that here in the hospital and then outside of the hospital as well. The fellows as a group certainly have weekly and monthly social gatherings outside of the hospital, some of those inclusive of faculty, some just on their own. We have barbecues, we've gone to the golf driving range, all sorts of other activities. We have a wellness retreat once a year, and it is not uncommon for the fellows to be going over to faculty's house just for drinks or dinner.
Yeah, here there is no hierarchy, which is, I think, one of the unique things about working here. You walk these halls every day with people that you don't realize are nationally known and internationally known and have more papers than everyone else in the nation on certain things. And you just don't realize that because people here come to work to help one another, to be part of a team, to support one another and support the growth not only of themselves, but more importantly, the growth of our team and the growth of our fellows.
One thing that we as a group had spent a lot of time doing was formulating a mission statement. And mission statements can really be a lot of huff and puff and things that people don't take very seriously. But we spent a lot of time thinking about this, and I think it's a creed that we all try and live to every day. And that is service, team, and integrity. And that is our culture, and that's a culture that we protect every minute of every day. And one of the first things we talk about when we have our new fellows here is we talk to them about that creed. And the other thing we talk to them about is our answer is always yes. We don't care what the question is, the answer is always yes. Can you come do this echo? Can you come see this patient? We do these things when it's not comfortable, but it's part of being a great consultative service, and it's part of our culture. And again, we defend that every single day.
Thank you so much for taking the time to listen to us today. I hope you learned more about our program here at Emory and Children's Healthcare of Atlanta and all the things that we would have to offer you as not only a fellow, but truly as a member of our team and family here.
Certainly, pediatric cardiology is a very small, tight-knit group, and so regardless of whether you train here or not, I'm sure we will be crossing paths later in the next few years. I certainly hope I get to spend some time with you here because after viewing your applications, we recognize that you really are a top-flight physician. You're going to be a great cardiologist, and I hope certainly that part of your training involves Children's Healthcare of Atlanta and Emory University.